so you're pregnant, right? And you're doing all the things that you can to make sure that you're going to have the best birth experience possible. So you take in all of these ideas and advice, but there's one piece of advice that I see people take, and it can actually really, really ruin your birth experience. And that is when you only prepare for the birth that you want instead of preparing for maybe the birth that you don't want. Now, I understand completely why you want to prepare for the birth that you want because, hey, that's what you want. Maybe you want an unmedicated birth and you want to know exactly how to do that. Or maybe you want to only take in positive birth experiences and those stories so that you can protect your peace. But one thing that I see people doing is holding on tightly to only what you're wanting to get out of your birth experience instead of opening your mind for the possibilities of things that may happen. I'll tell you a story of a patient that I had recently. So she came into the hospital and she told me her birth plan, and I wanted to sit down with her and talk about all of her options. She put her hand up and she said, "Oh no, we're not doing that because I am only going to do things the way that I have planned." And that made me really nervous as a labor nurse because I know how easy it is for things to kind of go sideways. And when we have a calm moment, that's the best time to talk about things that could happen. So when we really limit the way that we take in information, it can cause us to be really, really married to one thing. And then when we have to get divorced from that thing, it can be really, really painful. So what I would like for you to do instead is to open up your mind, and instead of just preparing for the one thing that you want, prepare for the birth that you don't want, just in case that's what happens to you. So there are benefits to protecting your peace and making sure that you only hear about positive birth experiences. However, birth rarely goes exactly the way that we want it to. And when we kind of open our mind and discuss some of the things that maybe we're not prepared to cross that bridge and maybe decide on, we can prepare ourselves to more gently go through that, and it can actually decrease a lot of potential birth trauma that you may have. Understanding that problems can arise can help you and your birth team to come up with maybe a plan in case that does happen for you. So it's necessary not only to familiarize yourself with maybe some interventions that maybe you aren't familiar with or maybe don't think that you want, but also understand why those things might happen or might be medically necessary, so that if it does happen to where your team comes in and says, "Hey, something has changed and we need to pivot to a different decision," you're not only familiar with what it is, but why it might be necessary. Maybe you're planning an unmedicated birth. Maybe an epidural is not anything that you want. But it's also important to know all of your options for pain control, so that if it does come to a situation where maybe you've been in labor for 36 hours and you weren't prepared for that, or maybe something has happened in your personal life, maybe your partner is not there anymore, or maybe you were expecting your mom to be there, maybe you don't have the support that you were needing, you preparing for your unmedicated birth, you weren't expecting those things to happen. So sometimes we need to reach into the toolbox of our pain relief options, and knowing what those are is going to really help you in that moment. One of the best ways to relieve pain in labor and birth is to hit that subscribe button. What do you say? The subscribe.
Like, subscribe.
One of the best ways to relieve pain in labor and birth is to hit the subscribe button and the subscribe, like, and the bell. So one of the best ways to relieve pain in labor and birth is to hit the subscribe button and the like button and also the bell button. I have 4 practical tips that are going to be able to help you to keep your mind open so that your options stay open throughout labor. So the first thing that you're going to do is you're going to get educated. You're going to take maybe some childbirth classes from reputable sources. You're going to maybe read some books, listen to what your trusted healthcare team has to say about things. Maybe you can ask questions from them. The second practical tip is to change your mindset. So instead of making labor and birth a pass-fail situation on doing something well or not doing something well, understanding that it's all about the experience and being able to trust yourself in those situations and being able to make those decisions decisions when you need to make them instead of making them ahead of time, because a lot of times things can change. Which leads us to our third tip, which is communication. And it's so important that you have really good communication with your trusted healthcare team. If you don't have a trusted healthcare team on your side and you don't trust who you're getting your care from, it's going to be that much harder for you to make informed and empowered decisions on the day of your birth. Discuss the things that you are more at risk for with your own personal risk factors that maybe you're more at risk for rather than Jane in room 203. If you are creating a birth plan, make sure that you are thinking about things in like an algorithm form. So instead of saying like, I want no C-section, no vacuum, no forceps, talk about the situations in which maybe that might change. So if your baby is in distress, are you okay with using a vacuum? If you or your baby's life is in danger, are you okay with having a C-section? A lot of the things that I see people put on their birth plan are like, no, 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 when maybe there might be some situations that come up where you might change your mind about something. It is so important that you prepare for birth not as a pass-fail situation, but as something that you're going to get through having made informed and empowered decisions. And you can do that by getting educated, by having really good communication with your trusted healthcare providers, and also having a great mindset that allows for change if things needs to change. So for those of you that have birthed children before, what are some things that maybe you put in your birth plan that looking back after you birthed them, you were like, I did not need to put that in there? Tell me in the comments. If you've made it this far, thank you so much for sticking around. I am kind of new to YouTube. I'm normally on TikTok, but I have a lot of excellent fun times planned for you and me and us together. And it's going to be great. And thank you for being here. This was enough torture for now.
That's it?
No, hold on. Thank you for being here. The fourth tip is to like and subscribe and bell it up. Do the bell. You can look for me on OnlyFans. You won't find me, but you can look.